Welcome to Mental Health First Aid. We have a changing of the guard happening right now at Edward Hospital and Linden Oaks, and we have a new partner with us, Elmhurst Hospital. We have our president from Linden Oaks here today, Gina Sharp, to talk about those things and new upcoming things happening at Linden Oaks.
Great.
Welcome.
Thank you, Barry, for having me here today. I'm excited to be here and talk about mental health and what's happening within our communities.
That's awesome. We've got a huge thing going on right now, a merger with Elmhurst Hospital. And it's like we have, like you said, 3 hospitals now in one.
3 hospitals in one system, yes.
That is very exciting. And the other exciting part was you have been promoted.
I have. Beginning in July, I was promoted to president for Linden Oaks and also vice president for the Edward system, where I will be able to lead more initiatives integrating both behavioral health and medical care as well, and advocating for services throughout the continuum of care.
So this wasn't like a new thing for you. You've been in Linden Oaks for quite a while, haven't you?
I have. I've been with Linden Oaks for 9 years now, and started off as controller for Linden Oaks. Where
What is a controller?
Controller, I know that's such a strong word,
Yeah.
and people often wonder what it means. It's overseeing the financial operations for Linden Oaks.
It is a big thing then.
In behavioral health, as many individuals might be aware, it's usually a service line that loses money for an organization. Reimbursement is tight in behavioral health, and operating margins are very, very thin. And so I was asked to come on to Linden Oaks in this new role to help work with the different program managers and look at operations and what we could do to really make us a more efficient system.
So you were like the right-hand person of Lou Mastro.
I was. Lou recruited me to Linden Oaks. I had worked with her prior to coming to Linden Oaks in Edward as one of our business analysts for the organization.
So you worked for Edward before?
I did.
Oh, I didn't
yes,
know
I've
that.
been
Yeah.
I've been with Edward now for 14 years.
Oh, wow.
And
Very neat.
then I had twins, and when I came back, they asked if I wanted to move over to Linden Oaks. It had been a great team. I enjoyed Lou. She had a phenomenal vision for Linden Oaks, and I've already had relationships with the team, and I decided to move over to behavioral health.
Lou came up with the idea for Mental Health First Aid for us, and she researched it and
did.
found out. Well, you were right there
Yes.
with her,
Yes.
being part of it and stuff. So
Yes.
that's what was really a little bit easier for us as people that work at Linden Oaks, that we had an inside person coming up and taking control and knew what was going on. You know, and probably was part of the decision making at that point too.
Yes. So over the course of the past 9 years, when I started off in financial operations for Linden Oaks specifically, I had been given more and more additional responsibilities, and really formulated and grew our Linden Oaks Medical Group. We started off with purchasing one of our really strong physician practices, which consisted of 3 doctors, and we are now up to 17 physicians, 3 nurse practitioners, and a couple of therapists as well.
So they all work at Linden Oaks building, or are they different areas? They like have offices all over there.
So Linden Oaks Medical Group, which is our employee doctors, we also have very strong relationships with our independent physicians as well.
Okay, so that's the difference. Independence, what you're...
Yes, so in total, Linden Oaks, there's probably about 30 active psychiatrists on staff.
Wow.
And of
That's
those...
a lot, isn't it?
That's a lot in one concentrated
Psychiatrists are
area.
hard to get, yeah.
Very, very hard to recruit to an organization.
Right.
And we've been very fortunate to have independent doctors who remain very loyal to the organization, and we keep them engaged as well because they provide a lot of knowledge and talent to our hospital and quality of services. But we've also employed now, we'll be at 17 by the end of August, psychiatrists as well, who can help cover a lot of the open on-call shifts as well, and take all insurance panels as well.
Right, right. With all the different programs going on, all the different entities, there's got to be so much.
There is.
How do you, I mean, and you're a leader.
Yes.
I mean, are you ready?
I'm ready to jump in. Over the last 6 months, we've really worked on our strategic plan and vision for Linden Oaks for the next upcoming 3 years. And I championed that project along with a team of folks within the hospital. We interviewed our doctors, we interviewed our staff, we interviewed our leadership team as well as community partners to see what is the need, what is missing in our service lines that we can continue to grow grow and expand to be able to provide premier behavioral health services to our community.
So it wasn't something cold you came into. You have been working on this for the last 9 years, basically going to the different programs and trying to come up with ideas and to make it stronger.
Yes.
This was a tough time to come into this profession, wasn't it? I mean, there's a lot of places going under.
There are, and I think that was one of the factors that had driven me to Linden Oaks, is to see how can we continue to make it a more self-serving, profitable organization, so we can continue to reinvest in our facility, reinvest in new buildings and new growth to bring these much needed services to our community. As you know, 1 in 4 Americans suffers from some form of behavioral health disorder.
Right.
And so it's very prevalent. And I think as healthcare reform is going on and Obama has been implementing new initiatives, you have the Illinois Health Exchanges coming on board, there's going to be a lot more people who will be in need of services with access to coverage. And so how are we going to be prepared to help treat individuals for those services? And I think Linden Oaks has done a phenomenal job in teeing us up to be able to have different satellite locations and ease of access to services.
Our building itself, our hospital, we call it's considered a hospital, right?
Yes.
Our building itself. Yep. How many beds, how many rooms do we have there?
Sure. Linden Oaks Hospital is a 108-bed inpatient facility, and we also have 3 satellite locations for partial hospitalization, which is a day program, an intensive outpatient program. The hospital itself, with 108 beds, has 6 distinct inpatient units where we're able to program like patients together, so that you don't have an adolescent on a unit with a geriatric patient, which is really nice because it provides unique clinical programming to patients specifically.
Right.
So we have an adolescent unit, we have a eating disorder unit, detox, adult, geriatric, generations, and a special intensity unit as well. Each
one, I mean, with special programs and special things happening, each one, I mean, even like the geriatrics unit, I mean, the way it's constructed, it's made to help, and the floors and everything about it, it's just tied in. A lot of work, a lot of energy goes into each entity to try to figure out the ultimate and best for that program.
Absolutely. In fact, last year we were able to receive some capital funding to be able to expand some of our units as well. So we were able to gain an additional 8,000 square footage. And when we did that, we renovated each of those units to give it a facelift, as well as to make it more functional.
I tell you what, when we come back, let's talk more about that, about each unit and see what's made up and what's happening with it. I think a little sneak peek inside to try to explain a little bit will really help out and give us a little bit more knowledge about that. So stay with us, and we'll be right back.
Listen, I know you're upset, but it was just one date. And dating's like the stock market. There's ups and downs and ups. So always buy low.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Whatever we deny or embrace, for worse or for better, we belong together.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Real men know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Welcome back to Mental Health First Aid. We're talking to President Gina Sharp from Linden Oaks, and we're learning a little bit more about the different programs we have. We've got a lot of programs outside of the hospital itself and different entities around the immediate area.
We do. We have been very fortunate to really take a focused look at the needs of our community. Mental health and substance abuse have been two top priorities for our community to help manage and take care of. So what we have done, last September we opened up our new site in Naperville, which is north of the main hospital, right off of I-88. We call it our Mill Street location. It's a 45,000 square foot facility dedicated to behavioral health services.
Beautiful building.
It's beautiful. It's all outpatient-based services, so patients can come for partial hospitalization, intensive outpatient, as well as to see a psychiatrist or a therapist.
I know we do trainings there also. We have a nice, beautiful room in there. We can have, I bet, 100 people in that room.
A lot of trainings. We do a lot of our mental health first aid trainings there as well, which you've been doing really a phenomenal job spearheading as well.
Yeah, we really enjoyed it. And you're talking a little bit about the different mental health issues going on. The highest being anxiety, next being chemical dependency, and then depression going in there. So there is a lot going on.
There is a lot going on, and we offer a wide variety of programs at the Mill Street location for outpatient services. There's a specific anxiety program, so adults as well as adolescents could come and program for services. They focus on school refusal, anxiety, as well as an Asperger's program.
So school refusal would be where a child they've been in trouble, had problems, and they've got to get back on track before they can go back to school.
Or they're too anxious to come to school. They're afraid to go to school for whatever reason, bullying or grades, studying, a test, and so they have this fear of going to school. And how do we get them to go back to school?
We've got sort of a unique program that way where they can go to school while getting help.
Absolutely.
They do their studies at our facility.
During our programs for both inpatient as well as outpatient, we provide tutoring services where we have certified teachers who spend time with...
We have like 6 teachers, don't we?
We do, yeah.
That come up and take care of all this. And I know there's an administrative assistant that calls the schools and arranges everything with them. I think that's huge.
A lot of communication going back and forth between the school. For the tutoring component, it's really about academics, and then we have actually school liaisons who are part of our clinical program that work with the different social workers at the different high schools as well to make sure that when adolescents transition from Linden Oaks back to their school, they have an easier time integrating back into the school system.
It's almost like we're integrated into school and they're with us. So it's a transition. It's not like a black and white thing where you get to go here and a stigma involved and different things involved with it.
That's right.
Yeah, that's really exciting to have that. I know with the marketing, we work with the teachers once in a while and they help us out with through different things.
They do.
And they are licensed teachers that they get their information from the schools and they complete their studies so they're not behind when they go back in 2-3 weeks later.
That's right.
That is just huge.
That's right.
And that's just one of the things that we do.
That's one of the things we do, yes. We also offer self-injury programs for individuals who use cutting as a mechanism to deal with their anxiety, their issues, their depression as well.
One of the things we talk about, mental health first aid. If you'd like to take the class and learn more about that, we can do that too. Yeah.
Absolutely. At the Mill Street site, we also offer a chemical dependency program. I should call it addictions, because it's not just alcohol. It's a wide range of addictive services use that we would use. So we have a robust program there for that. We also offer just general adult and adolescent mental health. And one of the phenomenal things about Linden Oaks is that we've worked very collaboratively with the Joint Commission to receive disease-specific, a gold seal of approval from them for 6 of our programs.
So what does that mean? I mean, is that like a high pretty high caliber thing to get from
It's a high accreditation from the Joint Commission saying that we have quality programs that have been surveyed by them, that we're meeting different standards and we're monitoring different outcomes of our patients so that we can continue to provide excellent service to our community. And those 6 disease-specific certifications, that's a lot. I think we have the most certifications out of any facility for behavioral health at Linden Oaks.
Okay, here's a weird thing I'm going to bring up, but it's sort of neat, but
Okay.
it's sort of different. Our cafeteria is awesome. I like our food.
It's good.
You know what I'm saying? I mean, you go to different places and you go, oh, food, hospital food. Ugh. Man, I eat there all the time. It's really a decent, so our people are inside the hospital and stuff, they can eat at our cafeteria and get some really good meals.
That's right. For our inpatients, we have a cafeteria that both the patients, staff, as well as any visitors who are coming through who might need a meal can go through and eat there. The food is delicious. We've been working with our vendor to continue to improve it over the years. About, I would say, 8 years ago, we renovated the cafeteria to make it much more functional and really did a lot of deep dives into the servings that are offered.
Yeah, doing a great job there. You know what I was really, and I've been with Linden Oaks now for 3 years, and the things that really impressed me with the building was the initial hospital building. It's so clean and so nice, and the out areas, the gardens. I mean, that's so, you know what I mean? You get out of that industrial type commercial setting and you just go out into open areas.
That's absolutely true. Every unit in the hospital is attached to a healing garden where oftentimes you will see a therapist, a physician, out there with patients, either one-on-one or in a group setting, doing their individual therapy or group therapy. It's a great way for our adolescents to go outside and get some fresh air, to play some basketball, to use exercise, because maintaining a healthy, active lifestyle is also important to your well-being and mental health as well. So we encourage physical fitness and exercise. This past April, we opened up a new healing garden as well, where we created a walking path.
Nice.
So you could walk a path throughout the center area there and receive some exercise.
And it's all
that
private, and it's all, you know, nobody can.
That's right. You can't see inside.
Right.
We have fences up that look very nice, so that the outside people can't be seeing who's in programming there.
Really
it's very
nice.
private.
All the way across there. We have other buildings, and you mentioned Mill Street, and that was a building we didn't purchase it, but we're leasing it. We put a lot of money. It's been totally gutted.
That's right. It was
redone.
100% gutted and renovated.
It's absolutely gorgeous, and that's on Mill Street.
That's at
and
Mill
we
Street.
have other places.
We do. We also have a location in Plainfield that opened up probably about 7 years or so ago as well, and that service has been much needed by the Plainfield community as well.
Now, is that considered an Edward Hospital, or is that Linden Oaks?
It's a Linden Oaks program. It's sitting on the campus of the Edward ER.
Right.
So it's right there on
really
127th and Van Dyke Road.
Yeah.
Easy access to services. We have great relationship with the Plainfield school districts as well. And then we also have a third location in St. Charles, where that's probably been open now almost 3 years, this upcoming October,
Nice.
where we're able to provide services to the St. Charles area
Let's talk
as well.
more about that when we come back. We'll talk more about the different buildings we have and different things that are happening with the buildings and the different programs. There are so many specific programs out there that help out. So stick with us. We'll be right back.
Everyone has friends. There's online friends, friends to go out with on a Saturday night, friends to hang out with and do nothing, friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
Hi, how are you you doing today?
What looks good?
Our special today is shrimp scampi. It's been sitting around for about a week.
Excuse me. What time are you guys leaving? We're gonna rob your house tonight.
Don't you wish there were warnings to protect you from life's risks? With diabetes, there is one. It's called A1C, a simple blood test that helps measure your risk of serious complications. Learn more at diabetesaonc.org.
No, what'd she say?
She said whatever.
No, she says that all the time.
What's that?
Hello? I'm on the phone.
Mom, I'm on the phone!
Hello? I'm on the phone.
Who's this? It's me. I'm on the phone. Mom.
Oh, you're on the phone. All right.
Sorry.
Sorry. Anyway.
Who are you talking to? Kelly?
Mom.
All right.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Welcome back to Mental Health First Aid. We have President Gina Sharp here from Linden Oaks, and we're discussing the buildings and programs and all different types of things happening right now. That includes mental health first aid. But we're going to talk a little bit about Elmhurst Hospital, our merge with Elmhurst. We mentioned some things. I saw some pictures of the building. It's gorgeous.
It is a beautiful hospital. It was designed for efficiency and really to be in a calming atmosphere. It's also received Plane Tree designation, which is really focused, similarly to Edward, on the healing environment, music, and art therapy as well.
Nice.
In fact, it was named the second most beautiful hospital in the country.
Wow, really?
Recently.
Very nice.
Yes.
Yeah, really exciting to be a partner with them now. And
we're very excited and really looking forward to partnering with them on continuing to grow and expand the behavioral health services offered to the Elmhurst community.
yeah, that's, we're really excited about it in marketing and all different aspects. In fact, when we did our mental health first aid instructor training just here recently with 30 new instructors, one of the Elmhurst people joined us.
That's
and
right.
they're an instructor for it also, so we'll be bringing some of the classes over to that end of it. You know, we were talking about mental health first aid a little bit, and that you probably were part of this with Lou, because you and Lou were pretty tight. I mean, with the information and stuff, and just a great pair.
Yes.
I mean, just really worked well together.
We even shared an office.
There, I remember that. Yeah, it was just really neat to have that. What are your goals and aspirations for? What do you see at the future for mental health first aid?
I'm really excited about mental health first aid. The city of Naperville has fully embraced the education and the training to the schools, the clergy, the policemen, the fire departments, and with all of the recent activities happening throughout the country, wanting to be prepared as a community to help those laymen be able to identify signs and symptoms of mental illness or substance abuse issues, eating disorders. I think this is an excellent way for us to be able to continue to partner and grow our services with the community. In fact, I think we're up to 51 members who are part of our consortium who can go out there and do the trainings for mental health first aid.
That's exciting. Yeah.
It's very exciting. In fact, in June, the American Hospital Association and the White House, the United States White House, had a special subcommittee meeting that talked about mental health and the issues surrounding it. The American Hospital Association listed Linden Oaks as one of the 5 organizations who is doing a phenomenal job educating the community about mental health and the services provided. So we were very excited to receive that recognition.
I'm pretty proud of that.
Was discussed with President Obama and Vice President Biden.
Right, very exciting to have that.
Very exciting.
You know, and it was something that I was really impressed with Lou Mastrel, our past president, who is now president of Elmhurst.
That's right.
And she's in charge of that, so she's went up the ladder a little bit there to take care of that. I was really impressed, and it really took it to heart. She brought the program here, but it was also to give back to the community. And we charge $25 for the per person for the class. That pays for the book and paperwork. That's about it. I mean, so it just, that giving back to the community, I think, is so strong, and I'm sure you were part of that too when you guys discussed that. You know, how you want to do this, and will we be able to afford to do this? And yeah, we're making it work. You know, that's just really, really neat to see.
It is. Linden Oaks is a non-for-profit organization, and we really do want to do a lot to give back to our community. We look at the different programs that we offer. We have mental health first aid, which has been a huge success factor, I think, in educating our community about mental health issues. We've also just recently developed what's called Depression Aware, where individuals can go on the internet and do a screening on our internet site to see if they might need additional help or resources as well.
A self-check type thing?
Exactly, exactly. It's based off the PHQ-9, which is a standardized questionnaire that's often given in primary care physician offices as well. And so we really do want to do a lot to bring those services back to the community. We've also are starting to develop what's called signs of suicide programs to bring to junior highs and high schools students as well. And so we continue to partner and work on educational needs with our community.
I'm pretty excited that we can teach mental health first aid to 16 years and older. And we have, right now we're working, and I probably, okay, I'll say something. We're working towards this, and I want to give some kudos to the school district, Naperville School District 203. They are looking at possibly integrating this maybe in some gym classes, health room classes. Some try to get some of our younger kids taught mental health first aid. What a gift that would be. You know, to be able to give that to a 16-year-old older. Absolutely, absolutely. They have this knowledge and this to be able to help his friends and help himself and family members through some different issues possibly going through. This isn't going to happen this coming year. It takes time to get this organized and to the curriculum and everything okayed for it and stuff. So it'll probably be another year, but it's in the works. It is. And that's what's really, really neat.
And I think we're going to see that taking off in other school districts as well. I think we have great relationships with Plainfield, St. Charles, Elmhurst, Glen Ellen. A lot of our local communities have really partnered with us on this initiative.
We're pretty excited also with a couple of our colleges have taken this on. Benedictine University and Aurora University have both taken this on as accredited courses. So mental health first aid, they increased it to 15 hours. You put a paper with this, and a little more expensive than $25, but you get 1 credit hour. And that's really neat to see that we're really thinking out of the box on this, you know?
Absolutely, and I also think it's a great program for college students who are resident hall monitors, so that they can help make sure that the college students remain safe
Math and Science
as well.
Academy, all of their RAs took this, you know, and we're passing this on to several other colleges. North Central's had this. And we're still working with it. Joliet Junior College has had this. Waubonsee Community College is looking at creating a class also. So it's just really exciting to be on this beginning stages and watching this blossom and help out so much.
It is. Another initiative that Linden Oaks is focused on, where mental health first aid has also been successful, is really partnering with our primary care physicians. Because as you know, many of our primary care physicians see patients in their office who have some form of mental health needs. And so the doctors and the nurses coming through for that training has been very helpful for them to be able to help identify those signs and symptoms as well.
I think what's really helped with that is that they get more comfortable talking about it. Because you're a doctor or a nurse doesn't mean that you're comfortable discussing this, because we don't know what your background is with your family or what's happened. And maybe this is really hard for you to discuss. And I think the class softens that. You know, and it gives them a little bit more self-esteem and to be able to deal with it.
I know when I went through it, actually, I think you were my instructor. It was a phenomenal class, and it was full. I think there was about 40 people who were in the class, and a lot of great discussion taking place about how to identify those signs and symptoms, and then where to go to receive services, and how do you access those services, because that's a critical component of it as well.
We are always looking for new people, and I appreciate you being on the show today and talking about this, because just to pump some more energy and new leadership with this as goals going on, I appreciate that. But we always have classes coming up. There's classes happening all over this area, and you can contact me at Linden Oaks, and I can give you those classes, and we can get things done with it, and we really appreciate you watching and learning more about this. Be safe. Thanks for being here.